Welcome to the FMP Essentials Show. I am Dr. Yousef Elyaman, your host, and I am thrilled to have you here with us. Whether you're a seasoned functional medicine practitioner or just starting out on your journey, this show is going to be a go-to resource for mastering functional medicine and making a real impact in your practice and community. Thank you for joining us on the FMP Essentials Show.
Disclaimer, the content of this podcast is for educational and entertainment purposes only and is not medical advice. Always consult a licensed healthcare provider before making changes to your health regimen. Views expressed by guests are their own and do not reflect those of the host or producers. No statements about supplements or products are evaluated by the FDA and are not intended to diagnose, treat, or prevent any disease. Listening does not establish a doctor-patient relationship. By continuing, you acknowledge and accept this disclaimer.
Now sit back, relax, and enjoy the show. Hey everybody, I am excited. Welcome to the show. I have my good friend, Dr. Bajnath. Dr. B, thank you.
Thank you so much for having me.
Absolutely.
Awesome.
So, Dr. B is, I'm not going to fully spoil it for you. We're going to get his bio, but he is involved in something exciting that really all practitioners, all physicians should be doing, and that's precision medicine. That's more, and I'll let him tell you more about it. Dr. B, give me your 76-second bio.
Thank you. So my background is actually in molecular microbiology and medical laboratory science before starting medical school. I'm a board-certified family physician with additional training in anti-aging regenerative medicine and functional medicine, and I teach integrative medicine at the George Washington University. Okay. I'm also the co-founder and CEO of the American Board of Precision Medicine.
Nice.
And I have my own little private practice called the Institute for Human Optimization in Columbia, Maryland. I'm also the author of the Longevity Equation. And so that's kind of a background, a rough overview of my background, generally speaking. I like to do a lot of N-of-1 precision care in my clinical practice. And now just in training physicians and other, students in the field of precision medicine.
Nice. And can you explain to those that don't know what N-of-1 means? What is N-of-1?
So N-of-1 refers to this concept in the scientific literature where a single soul individual is at the root of experimental analysis. So in the context of what we do here clinically, it's more so looking at all the different variables that constitute that individual's makeup, and that could be multi-omic in nature, looking at the genomics, the transcriptomics, proteomics, metabolomics, whatever it is in regards to what that individual's phenotype or their biochemical expression is made up of.
Okay.
And furthermore, the NIH, the National Institute of Health, defines precision medicine as the interface between biology, lifestyle, and environment. Okay. So it's putting all those different variables together to really get a deep appreciation of the individual's phenotype.
And usually when they do studies, they're doing an N is the number of people, right?
Correct.
They're doing an N of many, several.
Thousands.
And you're saying, wait a minute, you genetically, everybody is different. We're going to treat everybody separate. You're going to treat everybody kind of individualized.
Correct.
Okay. And you can't really talk about personalized medicine without talking about genes. So I think today we're going to dive into, let's talk about genomics and genes and really how do you look at genes in your practice?
Oh, great question. So, I use different diagnostic testing companies depending on the individual's clinical presentation.
Okay.
If it's somebody that has some sort of mystery illness and some chronic complex illness that needs a little bit deeper of a dive, use one company over another company that's a little bit more wellness focused.
Okay.
So, but generally speaking, I like to use that as a framework to launch from. And because I think once we get a better understanding and appreciation of your book of life, that's 23 chapters or 23 chromosomes in length, that's been written and co-authored by your biological mother and the other half your biological father, that gives us a framework to look at and uncover kind of that blueprint, your instruction manual. And once we know some of those different variables that are influencing kind of your disease risk predispositions, we could have a more targeted approach at kind of unpacking what we need to focus on. So generally speaking, I genotype everybody or have them get their DNA assessed in some shape or form.
Okay, so you're doing some sort of genetic test, but let's kind of take it back a little bit. First of all, our genes. How many genes does a human body have?
Approximately 22,000.
So we have 22,000 genes in the human body, and really the genes are kind of the secret to our health and wellness, or lack of health and wellness, right? That based on our environment. And I think what a lot of people don't recognize is that you can actually change the way genes are expressed, right? Could you talk a little about that?
Sure. So when it comes down to it, I think that this concept of genetic determinism is not necessarily true, that 30% of your actual health expression is hardwired in your genetic blueprint, whereas this other 70% is environmentally kind of influenced, as you were alluding to. And whenever there's this genetic and environmental mismatch is typically when there's some sort of imbalance for which disease could manifest and express itself. So, and as you were referring to earlier, that environmental interface on gene expression is known as epigenetics. So I think of our DNA as like this giant antenna that's communicating with the environment, receiving all sorts of different signals and inputs, and having the ability to kind of upregulate or downregulate gene expression based on the environmental exposures. So we're constantly, just like our microbiome is communicating with the outside world, influencing our gene expression based on the different environmental exposures as a whole.
And the microbiome is the total amount of bacteria that are on your person, right?
Exactly, or in your person.
Or in your person. And they're actually, they're interacting with us, and there's so much research now on this microbiome. But back to, I guess, the term epigenetics, or the way the genes are expressed. Just for the audience, like, you can have identical twins and one gets schizophrenia and one doesn't, and one gets breast cancer and one doesn't. And the reality is that what's that difference? What's that different factor? It's environment. So what are the components of environment?
Oh man, there's so many, when you get into the exposome, or the environmental exposures, this could be everything from what you're basically breathing, drinking, eating and consuming, wearing topically, and then
so it could be what you're getting into your system.
Correct.
And you called that the exposome.
Yep.
Okay, so for those of you that want sounding smart when you're playing cards with your friends, you start learning these terms. Watch this a couple of times. Exposome is one of those words they can use, right?
Correct.
It's an impressive word.
Yeah.
All right. So you have the exposome. So what else?
So the exposome is a summation of all these different environmental factors influencing us, right? So there's also some of these hidden exposures like electromagnetic fields and things of that nature that could actually influence our gene expression as well.
Would that be an exposome as well? Part of the exposome?
Correct.
Would food be exposome?
Absolutely.
Would exercise be exposome?
Yes.
It's what you're putting in. So
totality.
Exposome is basically the totality of what you're exposed to.
Correct.
And it could be food, it could be through your skin, through your lungs, it could be movement or lack of movement. So all of the sleep, is that part of the exposome?
That could be grouped into it. I think sleep is part of the chronobiome, and this is kind of
there's a second one. Dude, this is going to be the best card game, right? So chronobiome.
Yeah.
Tell me about the chronobiome.
So that kind of refers to your circadian rhythms and your, rhythms of life as a whole. And basically, we have these natural biological circadian rhythms that are built in, and we have these clocks within our brain and our peripheral tissues known as clock genes, and they're kind of synced to the environment as well. So like when we eat, drink, sleep, exercise, all of those different peripheral cues are influencing our gene expression, both centrally in the suprachiasmatic nuclei within the brain, and then peripherally in these different peripheral clocks that influence our tissue expression of certain genes that influence our ability to generate energy and, influence our metabolism.
So are you married?
Yes.
Okay. Do you talk to your wife about genetics?
Yes.
Yeah, a lot. Is she a doctor?
No.
Okay.
Yeah.
Does she get excited about it?
I don't know. I think she just placates a situation to get me to shut up.
Wow, he's so no. She's like, man, this guy's so smart. I'm so glad I married this guy. Yeah. If she's watching, she is one lucky lady. All right, so let's go back to genetics. So going back to genetics and analyzing genetics. Obviously, we don't have time to go over all 22,000, but let's narrow it down to maybe 3, just to give people an example of the kind of medicine that you do. Let's go over 3 main genes or gene variants that you would look at that would change the way that you actually would treat a patient. So what would number 1 be?
I would say there's so many different genes, right? And depending on, the symptomatic presentation and everything else, it kind of point us in a direction to what to look for.
Right.
But I would say, some of the core genes that I look at, in everybody, so we get a better appreciation of what's happening below the surface, would be, I like to pay attention to our risk factors associated with neurodegenerative disease like Alzheimer's and ApoE status. So ApoE refers to a cluster of gene haplotypes that are associated with our ability to metabolize fat, right, and cholesterol in our system. And if we don't have the ability to metabolize and utilize it appropriately, sometimes these proteins and fat particles and cholesterol gets misfolded and accumulated in the neurons, thereby increasing our risk for neurodegenerative conditions. So I typically like to look at ApoE status on individuals.
So let's talk about ApoE. So ApoE, there's different variants that you could get of this ApoE gene, right?
Yes.
What are the different variants?
2, 3, and 4, most notably.
Okay, and you get one from mama and one from dad.
Correct.
Right?
Yeah.
So you'll end up with a combination.
Correct.
Right? So 2, 3, 4, 4.
Yep.
Right. So which one? So let's talk about which one really predisposes you for like neurologic issues, like you mentioned.
So that's in the literature pretty well established with the ApoE4 gene. And you could either have a single copy and be a heterozygote kind of carrier for it, or you could have 2 copies of it and be a homozygote for it. And depending on the amount of weighted gene expression there, that could influence the compounded increased risk associated with developing Alzheimer's and neurodegeneration.
Now, looking at ApoE4, so that's, and you said it could be 3, 4, 2, 4, 4, 4, right? There's that, you get a combination, one from mom, one from dad. So taking a look at that, I know that is often called the Alzheimer's gene, right? But it really does more than just it's not just the Alzheimer's gene. And it's not a death sentence, right? You can have ApoE4 and you can live a healthy life. Is that correct?
Absolutely.
All right, so what do? You have a patient that has ApoE4. And I know personalized, you got to look at symptoms and whatnot, but what is that, when they have that ApoE4, what does it make you, how does it change the way you manage the patient?
That's a great question. So I think, that's when you really should do a deep dive into kind of all the different lifestyle factors, especially most notably sleep, because when we sleep at nighttime, we activate this kind of hydraulic pump within our central nervous system known as the glymphatic system. And that glymphatic system has the ability to wash away all those accumulated misfolded proteins in the system. And if we start missing, 1 or 2 hours of sleep a night times 7, days a week times, 4 weeks a month times, 12 months, that adds up quick, upwards of 672 hours of, missed opportunity to clear out those receptors with 1 or 2 hours of sleep deficit a night. So prioritizing sleep is very important.
And I remember I actually read that the Chinese they came up with a surgery that actually kind of shunts that glymphatic system, so it kind of helps flush it, because it's basically your brain accumulates toxins and you need to be able to flush it out. And you're saying you need sleep for that. I also read that sleeping on your side improves that. Helps. So you sleeping on your side, and interesting. We'll see what the Chinese end up doing, but they're actually doing a surgery to try to reverse Alzheimer's.
Interesting.
By doing that. So number 1, you're going to prioritize sleep. What else?
You're going to be paying closer attention to kind of the lipidology and some of the cholesterol factors that somebody has there to make sure that that's kind of well managed. You're going to be. I like to pay attention to another gene and actually. A biomarker called Lp(a).
Okay.
So that's also very clinically relevant for me as well, as it ties into, that additional predisposition towards vascular health and biology.
So if they have both, if you have LP(a) plus ApoE4, you got to be really careful with those patients.
Yeah,
right?
because there's a vascular component that could drive dementia. That's known as vascular dementia. And, as that correlates to endothelial health as well, we know that LP(a) is one of the main drivers of atherosclerosis and also has the ability to lead to hypercoagulation or thick blood and fibrinogen and like little clotty blood, thick blood that's there that could also accelerate that risk for neurodegeneration.
I hope you're enjoying the show so far. I just wanted to take a quick moment to thank our sponsors. First, Human, a company that is doing amazing work to support cardiovascular health and wellness, a company I believe in so much that I became the medical director of it. And of course, FMPessentials.com, your trusted resource for practitioner success with the tools and training you need to go deeper and get better outcomes. We're so grateful for their support in making this show possible. And now let's get back to our show. So somebody has ApoE4, one or two of the genes. How do you change their food?
So I always try to lean into a Mediterranean anti-inflammatory diet, generally speaking, rich in polyphenols and phytonutrients. Another pillar, that I like to teach at the university and mention in my book is a nutrigenomic association, where, when we're consuming certain foods, food isn't just, calories and, macronutrients, but it also is a rich source of information. And that information, that you're consuming in food is actually communicating with your DNA and influencing gene expression in the form of nutrigenomics. So there's another big opportunity there. And I also test for whether or not we have the appropriate amount of antioxidant concentrations in our tissues using a very special scanner based on Nobel Prize winning technology called Raman spectrophotometry to measure, whether or not there's an appropriate amount of tissue antioxidant status to keep those cells kind of protected.
Did you like Star Trek as a child? Have you watched that? Okay. Did you?
No,
Are you into it?
No.
Oh, I'm into Star Trek. But listen, if we end up going to Mars, we're going to get you. You're going to be like one of the doctors on like this fancy technology you got in your office. Nice, man. I need to talk to you and get some of them. So one of the things I've noticed with ApoE4 is that so there's this concept that saturated fat is bad for you, right? And the more I'm doing this, the more I'm seeing that, not for everybody. And it depends on where you're getting the saturated fat. So like coconut oil, it has a high amount, right? But is it an issue? Is it not an issue? Is it a health food? But one of the things that I've seen is that some of the people with ApoE4, when you give them those healthier fats, it actually can make them worse if you look at their blood work. Do you do anything with fat or decreasing fat or decreasing carbohydrates?
Yeah, I do. And okay. I like to look at the PPAR alphas and gammas as well to see how that's going to kind of influence the body's fat utilization.
Okay. And is that a blood test?
That's a genomic.
It's another gene.
Okay.
I said 3 genes. Dude. You give me 50 already. You can't help it though. You're a personalized medicine guy.
So it's stacking it all together and looking at it because there's a lot of a lot of my friends and colleagues are my practice is right next to my jiu-jitsu school. So that's what I like to do and train, and my kind of network is a bunch of grapplers and whatnot, and everybody's obsessed right now with the carnivore diet, right? And it's very interesting to see the hyper responders to the carnivore diet where, they might start infusing butter with their steak and, that's it. And all of a sudden their cholesterol is through the roof. And then for others, right, they're actually tolerating and processing and their cholesterol isn't as stressed and comparatively. And a lot of that has to do with their genetics.
And ApoE4 could be one of those keys.
Correct. Yeah.
So gene number 2.
I like to look at, let's see, MTHFR. That's a very trendy gene, and I think one of the classical examples in functional medicine and precision medicine.
What is your, I'd say, 60-second spiel on MTHFR? So
this relates to a biological process known as methylation, right? And it's your body's utilization of taking essentially a amino acid methionine and kind of reducing it down, right? And what is a part part of that kind of internal refinement and processing is a bunch of different B vitamins. Okay. And those B vitamins, most notably, is going to be the most important B vitamin is folic acid. Okay. And certain individuals cannot use folic acid appropriately, need a specific form of it called methylfolinic acid that will allow for your cell to use it better and process basically those amino acids better in the system for further refinement.
So MTHFR is kind of looking at how well your body can process folic acid, and some people just if that gene is off, if that gene is if that gene is downregulated genetically, meaning, or if they don't have as much activity of that gene, they don't have as much of that enzyme, and then you would give them that like 5-methylfolate.
Correct.
So,
correct.
Do you check homocysteine levels?
Of course.
Yeah, because your homocysteine could be high if that's the case.
Correct.
Gene number 3.
Okay. I like to look at various groups of glutathione genes, right? So GDX genes, generally speaking, those are very important for me to understand whether or not they have the full potential of their body's master antioxidant glutathione, and if there's an increased need potential.
Okay. So what do you do? Let's say you check the gene and you realize that they're not as efficient at making glutathione. Mm-hmm. What do you give them?
It depends, right? Okay. Again, furthermore on the situation, I actually would look at glutathione levels thereafter. I would also look at like gamma glutamyl transferase or GGT as another surrogate reflection of glutathione status.
And that's a blood test, right?
Exactly. Okay. And then there's metabolomic profiles as well that could be reflective of it. Pyroglutamate is another surrogate marker of glutathione status. And if it's, if there's signals that it's low, right, I would either do intravenous glutathione or I would give oral precursors like N-acetylcysteine to help with glutathione recycling.
Do you ever have them consume it in a different manner? Like, do you ever do like a topical glutathione?
I have.
Okay.
The topical glutathione's a little expensive, but
what about like acetyl or liposomal glutathione?
Oh yeah, all day. Yeah, the liposomal is usually one of the ones that I would go to as well.
Okay.
Yeah.
So I think this is a good place. I think this gives us a good overall what a precision doctor, physician does. Now, you have some exciting news, right? I know you've been working hard on a particular project, and that project has come to life. How about you tell us about it? What's this organization?
Oh, thank you. So, it's interesting, all of my life's efforts have, I think, kind of manifested now in this the purpose and mission of the American Board of Precision Medicine. I feel as though that from what I'm doing clinically and what I'm teaching at the university and everything else now, we need to take it to a larger stage and framework so that we could get a larger scale adoption of precision medicine in conventional care. So my colleagues and I, who are here with me, are we've co-founded.
Just for the audience, there's two shining stars. Yeah. There's actually light. We don't even need the lights because light is emanated right from them, right into our faces. So yeah, you guys are shining stars. So you guys are here, and it's the American Board of Precision Medicine.
Correct.
And it's for physicians?
Yes.
Okay.
MDs and DOs.
Okay.
And we're basically trying to create the new standard of care in healthcare. We've have all this amazing information, and we're trying to bring a lot of this information from bench to bedside and make it applicable into real world clinical practice. So we've created a fellowship and a board certification for physicians to go through. We're going to be having our inaugural cohort graduating next year.
Wow.
And hopefully, we currently have a ton of academic traction with a lot of major academic institutions and universities across the U.S.
So as this thing just blows up and is big, and like Elon is asking you to go to Mars and all that's happening, and I call you, are you going to still answer my phone call?
For you, anything.
All right, man. All right. So yeah, no. So how do physicians connect with the board if they want to be part of the board?
Yeah. So our website is www.theabopm.org.
Okay, and we'll make sure we put that in the show notes. Now, how do people stay connected with you?
I'm on social media
Okay.
a little bit, but you can find me on LinkedIn with my name or on Instagram, Dr. Anil Bajnath, and that's ANILBAJNATH.
Dr. B, thank you very much for sharing that. You are doing some exciting things. I look forward to seeing how the organization grows.
Thank you.
Your patients are fortunate. Thanks.
Thank you. Thank you.
Hey everyone, I'm Dr. Yousef Elyaman. We hope you enjoyed the show. Make sure you check out our website at www.fmpessentials.com for our blog and other content. If you enjoyed this show, please subscribe. Give us a like. It helps way more than you could imagine. Thank you for watching. Follow us across all social media platforms at FMP Essentials HQ. Please don't forget to share this with your practitioner friends, and we'll see you in the next episode.